This is part 2, Jessica Bridgforth again, physical assessment. Alright, Kelsey, we're going to start with your upper extremities. What I'm going to have you do is kind of hold them out. Look, turn them, flip them. I'm just looking over her arms as she's doing that. Her skin is warm, dry, and intact. There's no scrapes or bruises noted. I'm going to go ahead and feel for your radial pulse. And I'm going to do both sides to make sure I can feel that they're equal. And they are. They're both +2. I'm going to go up here and feel your brachial pulse. And it's +2. Alright, and then I'm going to check her cap refill. Both sides. It's less than 3 seconds. And I'm going to look at the angle of her nail. It's 160 degrees is what we need it to be. No clubbing noted. And I would check both sides as well on that. And next we're going to go ahead and do your lymph nodes. So Kelsey, what I'm going to do is, on this side first, go ahead and put your hand behind your arm there, or head. Alright, and then we're going to do infraclavicular first. And this may take a little bit. And then we'll do central, lateral, and then I'm also going to do subscapular, and then pectoris. And I don't feel any lymph nodes on that side that are enlarged. We'll go ahead and go to this side, Kelsey. Once again, infraclavicular, central, and then I'm going to do lateral, subscapular border, and then pectoris. And I don't feel any lymph nodes enlarged. Alright, Kelsey, the next thing I'm going to have you do is we're going to go ahead and go to your back. So as she's turning the back, I'm going to note that her ratio is a 1 to 2, which is what we expect for her ratio to be. If they had emphysema or something like that, they would be barrel chested, it would be 2 to 1. First thing I would do, normally I would have her in a gown, but since we don't have a gown on, what I would want is her skin to be warm and dry and intact, and if there's any lesions or masses, I would note those as abnormals. And what we're going to do is check for lung expansion. Okay, Kelsey, so take a big deep breath in and out. Do it again for me. Okay, and lung expansion is equal. And I'll have you bend over just a tad bit, Kelsey, for me. You can do this standing up. I'm going to feel down your back. Okay, transverse processes are midline. If there was scoliosis, there would be curvature there, but there's none. And also, I'm just feeling to make sure that her paravertebral muscles are intact, and they are. Okay, Kelsey, the next thing you can kind of sit up a little bit. I'm going to go ahead and percuss over you. So what that is, I'm going to do either indirect, which is where I'm doing like this, or I can do it directly on. I'll go ahead and do indirect for now. There's 10 points I want to hit. I want to do 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. And I would want to hear resonance throughout, and I did. Alright, Kelsey, the next thing we're going to do is listen to you, so just hold still. And I'm going to start up here again. And I want you to take breath in and out, and if it gets too much, just let me know, okay? So breath in and out. There you go. In. Kelsey's respirations are non-labored. Her breath sounds are equal and clear throughout. And now the next thing also I want to have you do, I'm going to feel and tell me if it's tender at all on either side.
No.
Any tenderness there? Okay. No CVA tenderness. And also we're going to go ahead and turn you around. Okay. The next thing I'm going to do with Kelsey is show her how to do a breast self-exam. With the women, I would have you do this, and the men would also do testicular. But we'll go ahead and do the breast exam. Kelsey, when you're at home, the way you want to do this testing is to check for dimpling. You're going to have your arms at your side as you look in the mirror. You're also going to put your arms at your hips and then behind your head. And that just helps to check and look and see if there's any dimpling. If there's dimpling or any abnormalities, you also need to let the doctor know and kind of consult the doctor as soon as possible. And a way you can do this at home is monthly in the shower, or you can lay down on a bed, and you can either have a towel or a pillow behind your shoulder blade for that. And you want to bring your arm up, And what we're going to do normally is you're going to start in a circular motion. I would do inner first, and then kind of work your way out, okay? So you're going to do inner light, and then inner a little heavier, and then inner, outer, excuse me, light, and then heavy. If you feel any lumps or masses, you let the doctor know as well, okay? And right now I'm watching Kelsey's respirations, and I see that her respirations are non-labor still, equal on both sides as far as I can tell. And then I'm going to go ahead and listen to her. There's 8 spots in the front that I want to listen to, so I'm going to go ahead and breathe in and out, okay? If it gets to be too much, let me know. Anteriorly, her breath sounds are equal and clear. And right now I'm watching her pericardial area to see if there's any heaves, lifts, and I don't note any. And also, like, I want to listen for thrills. Now we're going to do your heart sounds, Kelsey. So I'm going to just kind of listen to the heart area, and I'll explain where I'm at as I'm going through those areas. Okay, first we're going to start at the second intercostal space on the left sternal border, and on the right sternal border, and that's Kelsey's aortic. On the left second intercostal space, sternal border, is pulmonic. We're going to drop down just a tad bit, and third intercostal space, substernal border, is on the left is pulmonic. Sorry, Erb's point. Fourth will be tricuspid. Intercostal space, substernal border. And then the mitral is fifth intercostal space. It's mid-clavicular. A lot of times as females you have to go underneath the breast. This is also the point of maximum index. I'm going to listen for a full minute here. Okay, I'm going to turn my bell around here too. Now listen again. Okay. S1 and S2 are noted. Her heart rate is 75 beats per minute, and there's no murmurs noted. If there was anything else, I would note the abnormalities. Okay, Kelsey, what I'm going to have you do next, I'm going to look at your stomach. So what I'm going to have you do is go ahead and lay back and keep your knees bent up for me, please. Once again, I have the gown, and I would uncover where I can see your skin. I'm going to look at the contour of her stomach. Her stomach is flat. And I'm going to just look at your skin, okay, Kelsey? Her skin is warm and dry and intact. I don't want to feel too much because I want to listen first. This may be a little cold, so I'll go ahead and forewarn you. We're going to start in the right lower quadrant. And then we're going to go to the right upper quadrant, to the left upper quadrant, to the left lower quadrant. Now I'm going to listen for bruise, so I'll turn the bell around. We'll also go the same order again. Right lower quadrant first, right upper quadrant, left upper quadrant, left lower quadrant. Okay. Vowel sounds are normal active throughout. If I had to listen, I could listen up to 5 minutes per each quadrant. If they were really slow, you want to make sure you do that to see if it is truly absent. And then I heard no bruise throughout her abdominal area. Kelsey, next I'm going to go ahead and percuss your abdomen. Tell me if you feel any tenderness or if I need to stop, okay? Do it again. Okay, I hear tympani throughout. Over the liver, though, it's a little dull, so and that's what we expect to hear. Next, Kelsey, we'll go ahead and I'm going to listen to your aorta, and then your renal arteries and your femoral arteries. I'm going to use the bell of my stethoscope for that too. So first I'm going to go aorta, which is very high. Can I hold your breath for me? You can breathe normal. And I'm going to go ahead and go to the right, which is just directly below the aortic. Right renal artery has root. Left also has root. And we're going to go to the femoral, that's just above the subpubic area. On the right side, I hear root on the femoral. I'm sorry, right here. On the left side also. Okay. Kelsey, I'm going to feel, and tell me if you feel any tenderness.
No.
Okay. I'm going to softly palpate around. Any tenderness that way? Now we're going a little deeper. It's going to be a little harder. Any?
Nope.
Okay. And then I would also feel the borders of that liver. Okay. Any tenderness there?
Mm-hmm.
Okay. No tenderness? All right. You can go ahead and sit up if you want to. Okay. Now I'm going to inspect the lower extremities. Normally I would ask the patient if they had a gown on to pull them up. You don't have to. But I'm looking to see if there's, once again, if the skin's warm and dry, and I'm also kind of looking at hair distribution. That would tell me a lot. Okay, the first thing I'm going to do is I'm going to feel your pulses on your feet. So posterior tibial, and that's bilaterally. It's a 2+. Dorsus pialis. I'm going to find these. It's a 2+. I would check capillary fills on both sides. They're less than 3 seconds. Also, I'm going to look for varicosities on both sides. I don't really see any on Kelsey. And then I could check for edema. I would check the feet. I would check the ankles. And she has no edema noted bilaterally. And then that's about it. So, any questions about what we did?
Nope.
Okay. Thank you. And that's part 2. Next we'll do cranial nerves on part 3.